Hello, are we are here. We're gonna give it a few minutes for more people to come into the room. So we are super excited to be here. So few minutes.
Right.
If you are in our Zoom room, we are waiting a few minutes that we are going live in the Zoom. So this should be streaming on the Zoom. So give us a minute. We're trying something new. So we're trying LinkedIn and Zoom. So hot off the press.
Gotta love technology.
Gotta love
All,
it.
all the things.
And do all the things.
I feel super behind. I need a healthcare 101 in tech.
Me too. So for people that's in my Zoom, if you could click on and let me know if you all can hear us. All right, it looks like we are live in both places, Antoinette. So
Awesome.
we are going to get started. So
Awesome.
welcome everyone to the More Than Medicine Women Through Health Research. Whether you're here as a partner organization, your provider sent you here, you're a part of our community now, or you just scanned the QR code, welcome. Here, I'm Martha Dockery with Superior Clinical Research. And today, we're going to talk about something that's near and dear to my heart and near and dear to our guest heart, women. It is March, and March is International Women's Month. We've celebrated
Yes.
International Women's Day. So, no better way than to be in the middle of March than talking to the women.
Yes.
So, super excited. Please have the chats jump in. We love to make this an interactive conversation. So, if you are wanting to communicate with us, please do it in the chat. We will make sure that we address your questions and be here. So before we dive in, I just want to thank everybody that's on the call and that's going to watch us on the replay. So our CRO
Yes.
partners, our sponsor partners, our community partners, our provider partners. We are super excited to have everyone here. And this space is an open space for everyone that wants to hear, learn, and contribute to science. So now I have the extreme pleasure to introduce my guest. I'm a little biased because this is my friend, and this is Antoinette Belton. She is the founder of Biocentric Health Research and the founder of Antoinette on it. Don't you keep me honest. Belton and King,
And
or is
King.
it King?
Yes.
King
It's
and
Belton and King. Yes. It's
Belton
Belton.
and King
Yes.
organization, and Antoinette is a giant in this industry. So,
Really?
if you are not following her or you're not familiar with her and her organizations, please look her up on LinkedIn,
Oh,
Facebook,
thank
Instagram,
you.
all the things. Antoinette and I met up 10 years ago in this space,
Yes.
and we had became fast friends. She is a confidant. She is a leader. She has been doing this thing. Are you 10 years, 15 years? Where are you?
I'm at 12.
12 years. So, making a lot of noise in her own right. So I'll give her a minute to kind of
Same.
introduce herself and tell a little bit about her.
Oh, thank you, Martha. That's so sweet. Like, this is not the space to cry right now.
Please don't.
You are amazing. Okay, so in your in everything you do. So definitely thank you. So yes, as Martha said, I am the founder of Biocentric Health Research Center, and I have been operating my own research center since 2013 was when I started. Super passionate. When Martha asked me, of course I was like yes. Super passionate about women's health. My undergraduate degree is actually in economic development. And when you study economic development, you are taught that a nation is only as healthy as its women. Women reinvest like 90% into their community. We're the primary caretakers. So having a focus on women's health is extremely important. So I'm just happy and honored to join in on this conversation and learn. And of course, when you speak to Martha, you always learn something new. So there's a lot of things that I didn't know, like the ambient conversation that I'm sure that you're going to bring up, and that 80% of autoimmune diseases are women. So even in her inviting me to this conversation, there are things that I didn't even know that I'm learning that makes me, even more passionate to be involved and help.
And I think that's it, right? That's the
Advocate.
learning, each one teach one. And that's all
Yes.
how And my mother used to say, if you learning, you're still living. And I want to be
Yes.
living as long as I can, living and
Yes.
learning as long as I can.
I say the same thing. Awesome.
So before we get started, let's do a quick fire round. So just full disclosure, Antoinette and I popped on probably 10 minutes before here, so just so we can get out the way. So she have no clue of what I am going to ask her. So these are quick fire. Okay. So not boring. I don't like boring things. All right, you ready?
Yes. I trust you because this is different for me.
I got you. All right. Research gets a bad reputation in communities of color. True or false, and why?
I would definitely say true. And a lot of that has to do with history, mistrust. We all know about Tuskegee. We all know about Henrietta Lacks. So, there's a lot of mistrust still.
Mistrust and lack of education, right?
Yes, definitely lack of education.
Okay, I'm not going to say anything. Number 2, one thing women should stop believing about clinical research. Go.
Oh, one thing that women should stop believing about clinical research, I would say, is that they're guinea pigs.
That's a good one.
Yes, definitely that they're guinea pigs.
Okay. All right, number 3. What does research study that actually respect women look like?
Wow. One that is flexible, because of course, like I mentioned, I'm their caretaker, so they have to take care of the kids. So maybe having after hours, after 5, definitely on the weekends, and making it flexible. I would definitely, and maybe having like a hormonal, like start adding in, where are you in your cycle? Where are you? Are you postmenopausal? Like, those things too. So I think that's really important as well, to understand what stage and cycle women are actually in.
Ooh, I love that. And I love flexibility because, anything about me, we're open early in the morning. We're open late in the evening, Saturdays, Sundays, because you have to meet people where they are. And people do not navigate Monday through Friday, 9 to 5, right? Like, yesterday I had to run up out of here to take care of some stuff. So,
so definitely on the research side, I'll say flexibility. On the sponsor and drug development side, I will say in considering our hormones.
Okay, I love
that hormonal aspect.
Right, because you never know what day.
You never know.
I ain't in no good mood today. And it's probably hormonal moonish type stuff. Exactly. All right, last one. What would you tell a sponsor or CRO who wants to do better at community engagement?
Wow. I would say providing us with more financial backing to participate in those community events. And and even maybe better marketing materials and things
Okay.
that just will make it easier for us to be able to be involved.
Mhm.
Yeah,
Resources, right? Whatever those
definitely.
resources looks like.
Yes,
One of the things, and Antoinette, I know you do it at your site because I've seen it on your social media. We provide snacks. We
yes.
provide snacks for the community,
Keep that
right?
carrier working.
Right. You don't know what a bag of chips means to someone that's stepping
Mhm.
into a place,
Wow,
right?
that's true.
It's small, but it's a cost associated,
Yes,
right? And whatever that cost look like. And to me, if it's not paid, it's a cost that make people feel comfortable
that's right.
coming
It's
to,
inviting. Yep.
right? It's inviting.
Yeah.
And for us, we're both Black women. One of the things that we do is we fellowship with food, right? And
Yes, we
we
do.
break bread together. And that's
Yes.
kind of culturally what we do. So yeah, come in, get a bag of chips, get a snack because
Get a
we're
snack.
breaking bread together and we
Yes,
sit
that's
down
good.
and talk. So thank you for Hot Seat. You did a great job.
Yes. Oh, hot seat was hot.
All
Woo.
right. So let's dive right into community,
Okay.
right? We're both community research sites, right?
Yes.
So if we had to define what community research site looked like to you from a woman's perspective, what would that
Mm.
mean?
For me, that means being welcoming and inviting, having those extra community events like you host a CPR event, you know, or not event, but what is it, like CPR certification,
Mhm.
and just focusing on the community as a whole versus just recruiting. Because if somebody only sees, well, I need these patients, they can feel that they really don't matter. So having those extra events like that, and we do Biocentric Connect, so letting people know, hey, this is the importance of checking your blood pressure, and providing those resources outside of always the study.
And
So
you also do a free clinic, right? Like you do
so we
free.
yeah, so we haven't yet like fully implemented that, but Biocentric
Okay.
Connect is one of those things
Okay.
that we do,
Right.
once a month to, and invite our community in, just letting them know that we care about them outside of, like I said, the study. And we did the Mothers in Bloom that we did receive a grant for, so giving away diapers, and especially in this time because it's a challenging time financially for many. So we have a hygiene bank with toothpaste and toothbrushes and all of those things. So just again, think about the community as a whole and how we can help without just always focusing on recruitment.
And let's tie it back to women, right? So as women, as mothers,
Mm.
as caretakers, it's hard to try to take care of yourself when
Yes.
everything around you is not taken care of. So if you're thinking of having a conversation with me about this research opportunity that may be wonderful, I know it's a great opportunity for you, but in the
Right.
back of my mind, I can't feed my kids. So I can't really think about
That's right.
anything but. So even if it is bringing in an opportunity, one of the things that we did here that I thought that we loved, and it was off the cuff, that I was looking in the sales paper. So if you live in this area, and I don't know if you have, but we have a Food Lion
Yes.
local grocery store, right? And
Yes.
they had their pasta sauce and noodles on sale. And so I had told my dear husband, who I love, who would just do whatever. I was like, you know what? Take $40 and get pasta and noodle sauce. And we made bags of, ready-made dinners to pass out to the community because you can't meet people where they are when they're hungry. You
That's
can't
right.
meet
You
people where
can.
they are when they need
That's
stimulus.
so good.
You have, and so that's when we talk about meeting people where they are.
You
So
have to
now
talk.
we're meeting the basic need of the community,
Mhm.
right? And if the basic need is feeding, if the
Right.
basic need is childcare, right? Bring your child in
Yes.
for a visit. I have
Right.
tons of pictures of me playing with kids while the study coordinators are, providing the visit. Make them
And
feel
print out some
comfortable.
pictures. You just can
Right.
go to Google, print out some pictures, have some crayons. Yes.
Put on Peppa the Pig, right? Whatever it takes to make people feel comfortable. And then when they're there, make them feel comfortable. So
Yeah.
now we're meeting the needs of the community.
I love the meal. I love that.
It was easy. And we staple it in a little bag and we just pass it off. And we let people know this is what we're doing. One of the things that we're
Mm,
running now is we're running free blood pressure checks. You in the
yep,
area, you in the community, you want your blood pressure check, come through. We'll check
yep.
it, right?
We do the
Easy things
same.
that we can do.
Yeah, and the logs, and advocating for them to, hey, write down your blood pressures because
Right?
you'll be.
Because it's important.
Yep.
So, okay, now we've met the basic needs as much as we
Mhm.
can in our space. How do you have that conversation with someone who is have every reason to be skeptical? How are you having these conversations?
I think for us, the conversation is never really too difficult because I look like the person that I'm speaking to. So there's already like
Mm,
familiarity there. Um, and just letting them know pretty much the benefits and how it helps. Like, you are not only receiving a stipend, you're not only receiving medication at no cost, but you're also helping your community, the world, essentially, just by volunteering. So the conversation for me has never been difficult, especially when dealing with women of any race or background. It's
that's
Yeah,
good, right?
go
Because
ahead.
people are skeptical, right? I receive information that people that look like me. I receive information from people that has a commonality,
Yeah,
whatever that commonality is.
it
Maybe
is.
where we
Yeah.
went to school. Maybe it's we're in the grocery store looking at cookies, right? Like, but the important part is having the conversation, right?
Mhm.
And bringing the people in and saying, have you considered? Have you and just a conversation that we had internally in the office
Mhm.
yesterday with our study coordinator, Rebecca. We were talking about her parents sharing that she's doing research. And
Yes.
one of the things she was like, I don't know how she's sharing. I said, it doesn't matter how she's sharing it,
Mhm.
right? It's just opening the door for people. So when
Yes.
people are afraid, just open the door. If you know me, I ain't afraid of people. I ain't
No.
afraid to talk. I ain't afraid.
Right.
But when you get resistance, how do you handle that resistance, right? You don't get defensive because majority of
Mhm.
the time, I don't want to be no guinea pig. That's the first thing people say, and then you
Mhm.
lean into it.
Right.
What does that mean? Tell me, what does that mean? You're not a guinea pig, you're a partner, right? You're changing the
Definitely.
conversation. You're not ready today, and that's okay. But
That's
I'm
okay.
here to answer the questions. And if I had one wish, the wish would be that when you're in these community sites and you're this community base, a lot of it is building up
Yeah.
to
Making
make people
connections.
ready,
Yeah.
right?
Making connections. And also, sometimes we'll go ahead and be proactive and say, hey, look, especially because we're dealing with a more challenging protocols right now, like with
Mhm.
the UC and the Crohn's, there's a lot that goes into that. So I'll just move forward and say, hey, let me forward you the ICF so you
Yeah.
can read it over and you can discuss it with your husband, you can discuss it with your friends, your kids. And then that also helps and let people know, hey, we're all on the same side. We want you to be informed. So yeah, just totally,
And
it's
I
a
love that. I
yeah,
love that. Right? You're saying here, we're being transparent. We're going to give you this
yes,
before you even come in. Come in
that's
with your question. Do you want to set up time that we can talk through it?
yeah.
Let's do it, right? Versus
Here you go.
you're pressuring them at
Yeah,
the visit, 65 pages,
right.
flip, 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 right?
All these procedures that you have to do, the
Right,
colonoscopy. I mean,
right.
they even have to submit a stool sample. So when things like that, that could be super personal. So you have to make sure that
Right.
they're informed and make that connection with them and make them feel comfortable. And I think it comes easy for people like us. So
And I think just having that and just kind of speaking to the audience, right? Having that conversations with people, when you're even if you're a CRA or if you're
mm,
at a pharmaceutical company, ask the science, how are you having these conversations,
that's
right?
good.
Versus just assuming that people are just beating down the door.
Right.
You have to build these relations. And there are some people beating down the door. I have people that's like, hey, what studies you got for me, right? We have those people. And then we have those people like,
Right.
I don't know about this. Help me
Yes,
understand. So we have those perfect mix of
like a mix.
everything.
Mhm.
Okay, so let's talk about it a little bit more. So women, and I know this is your wheelhouse, so I'll let you flow.
Maybe.
Women have been dismissed in medical settings.
Yes.
Stress. You're being dramatic.
Yes.
You're okay, right?
It's not that bad.
That's not,
It
it's
doesn't
not
hurt
that
that bad.
bad, right? It's not that bad.
Yeah.
And research hadn't always protected the people it was supposed to serve, right? We could
Right.
we can talk about it. But knowing all of that today in the history, what does ethical, trustworthy research actually look like today? And what's changed for your 12 years? And then
Mm.
what do we need to do to change?
For us, that's a really meaty question. So I'll start with, say it again.
Okay, so what does ethical, trustworthy research look like?
Definitely listening. I don't do a lot of talking when the patient is in there. Don't do a lot of talking. I listen.
I
Um,
like that.
yeah, I listen. I write. Once they're done, I'll then, ask them maybe, some questions, let them. The number one thing is letting our study participants, our patients know that I see them, I believe you, and that your concerns are valid. Your pain is valid. What you're saying is valid. Um, so I definitely think that's like number one,
I
listening.
love that. Listening more than you're talking. You
Talking.
hear a lot when listening,
Yes.
right? They tell a lot. And if anybody that's in the pharmaceutical company or in the CRO world have never been at a site,
Mm-hmm.
you should try to visit one because there's some good times in what we do. There's some
Yes,
good
that's
people that
good.
come through the door. There's some good conversations, and that where a study visit should last 10 minutes.
Man.
It lasts 2 hours but that's the joys in what we do, right? That's the joys in having those conversations. But okay, I love that. Listen more. All right,
Listen,
second question is what has changed in your 12 years?
in my 12 years, what has changed as far as in research? I would say, as it relates to women's health, maybe that's what
Yeah.
you're saying. That what has changed? I'll say I feel like it's been kind of like a not one consistent. Like there's been just some fluctuations. So there was a point when there were several women health studies, like there were a surplus. You could tell that there was a lot of research and funding and focus on women's health. And so I feel like it's what's the word? It's like a cycle that I've seen where you don't see much women health advocacy. Then there's a point where you do see it through research studies. And then I feel like right now there isn't a lot. I feel like I don't want to be pessimistic, but that there's work that needs to be done so it could be a consistent thing, not an up and down thing, but a consistent priority that women's health is important. So I think it hasn't been like like I seen this thing and then it changed. I think it's just been like the fluctuations in the consistency of how important it is.
And then what still needs to be, right?
Yeah.
So what do we where do we need to go?
Where do we need to go? More, it all just comes down to more resources, more advocacy. Even today, just being transparent, because again, this was so good for me, is just how do we advocate? What are some measurable, strong ways that we can advocate for women's health research? So yeah.
So I think for me, right, and you and I talked a little bit about this before we hopped on live. The needs of women are different. And I don't
Yes,
think needs of men are different like that either. So we ain't talking about men, we're talking about women today.
that's
But
right.
what someone needs at 21 versus what they need at 30,
Oh, when they
what they
perimenopausal,
need at 45
that's right.
versus what they need at 60, right?
That's
There's so
right.
that women go through such a large
Yes.
array of
Life stages,
changes,
like
right?
life
And so
stages impact
understand
outcomes.
each stage at
Yeah,
each life. And I think you said it earlier, when we're collecting these data points, does the medication work differently if
that's right.
whatever, right? Like understanding what that looked like. So for me, if something needs to change, is how do we hit every woman at every stage of their
Right.
life,
Yes,
right? And supporting them at every stage in health and in research and things like that.
yes.
Okay, so y'all been on my lives, you've been in my conversations. You've seen me. You know, I dare not be in a space that I don't get to talk about mistrust because I think it's important. I think we need to talk about where we've been to
Yeah.
know where we're going.
That's right.
So, sometimes people are just afraid, right? They're afraid of the unknown. They are afraid of what's happened in the past. They're just afraid. Is this going to work? I have I have a true story for a woman that wanted to participate in one of our studies, and I think this is a really good segue into what we're talking about. And I understood her. So she wanted to participate in a study, and this study is a new drug on the market. It was a subcutaneous injection, and she said, "I live by myself."
Wow.
And I don't know if I want to try anything because what if something happens and I'm by myself? And so how do you share that? Like, how do you have that conversation with someone that's trusting you? Like, hey, I trust you. I don't really trust this drug, right? Like, and I think it's important. And I think it's important to just sit in the spaces with people and say,
right.
I don't know, right? Like,
that's an interesting one.
Those kind of conversations matter because that goes into the mistrust. And so what we did was I didn't dismiss her like, ain't nothing happening with this, right? Because I want her to trust me and that I would give it the best information that I can give her. But those are kind of the big things that happen when you're talking to real people.
That's right.
Stages in their life. Right.
Never thought about that. Never had that. That's an interesting one. Yeah, so what did you do? I would have said, well, we do have an emergency phone number that comes. What did you do?
We talked about all the things, right?
Okay,
we talked about, we talked about what happened in the other studies,
phases,
the investigative brochure. We talked about all those things. That didn't satisfy her. So you know what I told her? I said, you know what? You and I can agree that it's not the right fit for you.
Yeah.
And that's okay, right? This is not the right fit. You know what she does? She calls me every 2 weeks. You got another study that I can participate in? Right. And I think that's building that trust with people because, you're having these conversations with people and you're meeting people where they are. And people are afraid. People are scared. People don't know. You don't know what you don't know. Okay, so we have people in the rooms, have people on YouTube. Please, if you have questions, drop them in the chat. You want to chime in, we love it. Tiffany, we see you. Linda, we see you. Thank you, thank you, thank you. What do you do when people don't trust? Like, what do you do when you're like, you know what? I don't trust this. I don't trust research. I don't. What do you do? How do you handle that?
I'm just trying to think of a time. I think for just making sure they're informed. Yeah, making sure they're informed. Being supportive. Is probably a bad thing, but I do give patients my personal cell phone number.
Me too.
Yeah. And again, I don't want to be, the horse, but making those connections. And going the extra step that you went, like, hey, let's talk about preclinical phases. Let's go all the way back there and let's talk about this drug. And even if they decide no, they don't want to, you're still family. And that's another thing, just letting, especially our older patients, letting them know, like, hey, anytime you feel like you don't want to do this anymore, we will still love you, especially if they're like Dr. Boone's patients, or they have these kind of like, oh, I don't want my doctor to be mad at me or whatever, especially when they're coming from their physician and they still might not want to do it. If their physician is the PI. So we let them know you're still our family and we still love you anyway, even at any time if you decide this study does not work for you. So that's another thing too, letting them know again that they're not just a number. And like you all do too, you're our patient, you are a study participant. We need you. You're a volunteer, not like some subject. So we kind of took on you all Superior Clinical Research's whole like thing.
You're a partner. You're not a subject in this. You're a participant. And do you know, even to this day, I still correct the monitors that be like subject. I'm like, no, we're participants. We have no subjects here. And I think that's important.
Yes.
Right? People want to be partners. Words matter.
That's right.
And people don't understand that. Words matter more than people know.
Yeah, and even sometimes, like if they see the subject number or they'll hear or hear me say, "Hey, what's the number?" We'll let them know, "Hey, you may be because we work remotely with the sponsors. This is the number, but we know you by name. Like
Mhm.
just being authentic and
And I
well,
think that's important, being
yeah, if
authentic.
you care about people, they're going to know that you care about them.
That's true. And the other thing too that I just want to chime in to say is that within the community, they know us.
Mm,
They don't know blah blah blah. They know us.
that's
So
right.
when blah 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 is not right, it's
Yes,
us that they're
we got to
telling.
step up.
Right?
We
And
got
it's
to step up.
them people this, and it's us, right? And we take it.
Yes.
And I think, and that's the part, like even like while we do this, we educate, right? So one of the reasons why we have all these things is to educate, to bring people into our world, right? Because the psych
Mm,
world is a different beast
it
than
is.
in the corporate world. I've been in both spaces, been in all aspects of the
Mm,
pharmaceutical. I've touched every touch point. This space is
unique.
very unique, right? That's
Mhm.
the word, because you're dealing with people, you're dealing with real lives, you're dealing with my car broke down on the way, my Uber didn't come,
Man,
my baby got sick,
that's right.
I'm sick, right? You're dealing with so many things, and to understanding that it's okay how people flow, and people trust us. They
Right,
trust
they
us.
do.
They trust Martha. They trust Antoinette. They trust Superior. They trust Biocentric. And because we built that trust, right? We
Yes, you
built
have a great responsibility
it
for.
is a big responsibility.
Yes,
It is. And
yes.
and I love that you say how big are the responsibilities. And then the other back, tying it back to women, we have men that come in, and you know who come with them?
The one-
Their
yes,
wives
they know
or their
all. Yes,
daughters.
yes, they know all the answers. They don't know what they're taking. They don't know the dose. They don't know anything. So yes, I didn't think about
They
that.
do.
Again, that caretaker, that person
Yep.
that knows that
And
that's
when things happen, what your wife say? We
yes.
texting somebody, and I'm like, put
Well,
your
let me text my wife real quick.
right. And
Like
so
what?
that goes back to women can take care of everything.
That's
And
right.
cute. She said, I love that you reassure participants that you care for them is not contingent on their participation. They still
Yes,
matter. That is
it
true.
still
They
matters.
still matter.
That's right.
Okay. So let's talk a little bit about the history of women in participating.
Mhm.
You brought up a little bit of it. We talked a little bit about Ambien. I did a post yesterday about Ambien, speaking this up. Ambien, and I won't go in it because it's not my shine, but Ambien, the research wasn't done on women. And
Right.
so for years, and Antoinette, it was what, 1990? What was it?
92 to 2013.
Yes, that it was wrong.
I had
Women
no
were
clue.
dying, all the things. And so that's why it's important that women are at the forefront. And one of the things that you and I talked about yesterday in our brief conversation, it was 1993 that the FDA said women need to be included in research. Yo, that is,
And what
I
about
don't get my age.
the efficacy and safety data? Did you say 98?
Yes, yes. Listen, I don't get my age, but that was in my lifetime, y'all, right? Like, could
Yeah.
you imagine all the things? And we know it was a lot of it probably with pregnancy and things like
Yeah.
that. But when we were looking at those stats, one of the things that we did find out, it said women, it said gender, but it had nothing to do with race and
That's right.
ethnicity,
That's
right? So that was another thing because
and that was in the 2000s. That was just recently when that was made priority.
2000s, 20s,
Yeah.
and
I'm talking
it's
about
going
recent.
back. It's trying to shift back, but
Yes.
nevertheless, I think it's important that we talk about women. And you mentioned something. 80% of the autoimmune diseases are
These
women.
are women. And like I said, when I thought about it, I said in my world, in my life, I've never met a man that's had rheumatoid arthritis or lupus. I know you said you met like one, but
Yeah,
yeah, you really don't. I never heard a man say, "Oh, I have rheumatoid arthritis." It's typically always women who have the Graves' disease and all those autoimmune diseases. So I thought that was really wild.
and
80%.
then It's kind of, but then you kind of go back and forth, right? So then you
Right.
create these marketing materials, right? And you create this biases. So now you're creating, and we're talking about women. So
Yeah.
we're being, let's be honest. We're I love to talk about my plain language. I love to talk about plain language. But you create these flyers and you create these
That's
things
right.
that's always geared to women. So now it's 80%, but there's 20% that's men. So how do we do
True.
better with bringing everybody in,
Everybody, but
right? So
being
even if you think it, the flip side of it, if something that's more male dominant,
that's true.
we're not calling women in. So how do we be inclusive across everybody in our efforts to reach everybody, because we want everybody to participate?
To be so still having an overall mindset that I am being inclusive, that I am being welcoming, but also at the same time knowing the statistics. I think it's
Mhm.
okay to know the statistics as well as making everyone feel comfortable. Like
And I think
having,
that's a hard fit, right? I think that's a
yeah,
hard, that's a hard middle ground.
yes,
80% of women, so we're wanting women,
right.
but or the
You
flip
want to leave out the 20%.
side. Because if I'm looking at something, right, if I'm looking at any kind of marketing, right, even if I'm looking at something on the TV or whatever,
Mhm.
I'm not a big consumer, so I don't consume a lot of stuff.
Right.
But if I want to participate, if I'm thinking about participating in something and it looks like it's geared to men, I'm probably gonna be like, I
Eh,
don't have nothing to do with it.
right.
Like, if it's
Yeah.
and women were players, so y'all don't cancel me. I ain't no plaid world. So if I look at something that's plaid, I'm be like, yeah, that ain't for me, right?
Right.
So, but just understanding, even when we're thinking of how to build trust with people, if we're wanting more
You don't
people,
want to
more
leave
women
somebody
to
out.
lean in
Yeah.
and participate, we have to make things that's more inclusive for everyone.
Everybody.
Right? We talk
Absolutely.
about,
But still knowing the information and the facts, I think is,
right. It is important
yeah.
to know the facts. And then
Yeah.
also too, when these statistics, right? Where are they coming from? Are we meeting everybody? Are we saying, well, 80%, and I don't know the facts, but 80% of women, what women, are they
That's
black women? Are they white? Are they, what
good.
type of women are they? So then we can always drill in. I
Yes.
know, and I know you know the stats of your sites because we've talked
Mhm.
about them. We
Yes.
can drill down to the percentage of every
Mhm.
ethnicity, gender within our group. And if you have a site, your site that's listening, or you're an advocate, or you're a sponsor, you should know that. You should know
Yes.
the demographics of
Graphics of
the
insight.
area, right? At
Yes.
the area that you're in. Because if you're saying we're looking for women and your demographic is majority men, you might not get what you're looking for. And
Exactly.
be honest with that, right?
Yeah.
And saying, um, this is what our demographics are, this is what we can bring to the table, and then opening up that casting net.
I think that's so good. I know the stats in because again, I'm transparent. I'm learning. I learn every single day. And so I know the stats of our site, but never thought like, what are I'm gonna look that up today. Like
Yeah.
what are the stats of our
Oh yeah. I
yeah,
noticed for all 5 of our locations, I can drill
yeah,
down into the zip code, right?
exactly.
Overarching
Good.
to know who is our
Mhm,
target market, and people
mhm.
should know that it should be part of your metrics. So when you're having these conversations,
Conversations.
and
Yeah.
you're
So I
doing
know like the
CROs and stuff, you should be able to have these conversations because that's
conversation.
gonna help you with feasibility, right? Like,
Right.
you want us
That's
to get
good.
55,000 women, they ain't but 200 in this area. It ain't happening, right?
Right.
And so be honest. Like, you want to be honest with people, making sure people know
That's good. Like a
exactly
racial and gender breakdown of your
yeah.
region. So it's like I know the socioeconomic stuff, but I'm curious to, you know what you see, right? Because you're out in your community. But yeah, I'm gonna look those up today.
Yep. But please
Yeah.
do report back to us and let us know. Report back on this post on LinkedIn.
Yes, because I only know the stats of our site. Like,
Okay, so flipping the script a little bit. Let's talk about advocacy,
mhm,
right? I feel like I wear an advocacy title. because I am an advocate for clinical research. I have a pen that I just recently got. So shout out to the type 1 diabetes summit that I went to, that they gave me a pen that said clinical trial hero. And I wear that pen, Neil, because I want people to ask me. There used to be a button around. Somebody used to say, ask me about, right? So I need to get a button that say, ask me about research. Something big, because I want everybody to ask me, because I want to be able to talk about it. So we all should be advocates.
Right.
So you don't have to go to school to be an advocate. You don't have to have no fancy title. Being an advocate is showing up here, right? Learning the facts and things like that. And so being informed is very important. So informed people make the best advocates. And so what does advocacy look like for women who just watched this webinar?
Advocacy. Learning more about clinical research, learning more about how you can be a part of the clinical research process. Like, what can I do? What information can I retrieve to put out? And like you said, get more educated so then you can educate others.
I love it, right?
I'm talking, but I'm thinking about getting some t-shirts too that says, hey, ask me about clinical research.
Let's go in half, girl, to get us some. And so, but it's true. Advocacy, to me, advocacy showing up here is part of it. You're sharing this with someone. I learned this. And the other part too is you hear something, research it.
Yes.
So it's so easy these days to research something, right? I am, and I love to talk about all my shortcomings, but you can't tell me anything. So if you know me, I'm from Kansas City, so I'm the show me state. You gotta show me everything. So most people can't tell me. If you know me, if you telling me something, I'm looking in the regulations. I'm searching it because
we know,
right? I want to learn, and I want to make sure that information that I'm gathering is right. So that's right. You hear something, look it up, research it, learn it. Sharing, one of the things that my daughter says that I admire about her, each one teach one, right? We each one teach one. So if you learned something here today, share, reshare this broadcast. Go to, if you're in this area, go to a site. If you're in my area, you're in North Carolina, stop by and see us. We would love to host you, to show you. Antoinette the same in her area in South Carolina. Reach out, learn something, connect with someone you don't know on LinkedIn. Talk to your provider. Majority of the people don't participate in research because they're not asked. When you're for the pharmaceutical companies and CROs on the team, have conversations. This is training that I talk about in London. I'm sure you're going to give me a thumbs up. It's the Just Ask program with Duke, right? It's a program that it's for providers and doctor's office that just says just ask, right? Just ask everybody, and it's a really good. It talks about the implicit, unconscious, and conscious biases of people. Some people. Prime example, some people are not asked because they come into the doctor's office with their child. Well, we're not going to ask them because they're not going to have child care. Or, they maybe not comprehend the language that you're speaking. Well, we're not going to ask them because. So, creating spaces that we just ask everybody, can you participate? Would you like to participate? Do you even understand, before we ask anybody, do you even understand what clinical research is? You'll be surprised how many people don't understand the drug process, how it takes to get the drug on.
And everything that they pretty much took has been through the same process, with the exception of like vitamins and things like that.
Right.
Nobody have to go take them because they haven't been studied.
Let's not go there. That could be another conversation. We digress. But most definitely, so advocacy to us looks like showing up and being present and understanding and learning more. Yes. And then before we wrap up, Antoinette, I really
this was fun. Already 45 minutes.
45 minutes.
This was fun. You should have some more hot seat questions. You had that brain. I like when that cognitive function
we'll have to, because one of the things we do like for these webinars, so that people can listen to them on their lunch break or, doing their work day. It doesn't suck up too much of their time. But you are welcome to come back
Yes, I
anytime
love the hot seat.
you want to. And I will tell anybody, if you're sitting on this space, before we kind of wrap up, because I want to make sure you get a chance to say, but if you're in this space and you want to sit here and conversate with me, or is there something that you're passionate about, please, you don't have to be in the industry. We've had participants participate. We've had doctors, we've had lay people. We've had so many people that can share their knowledge, because once again, each one teach one. So, I want you to have the last word. What do you want every woman who joined us today carry with her? And then for the men that joined us, what do you want them to carry with them?
A hot seat again, without being called a hot seat. I would definitely say that I want women to know that they matter. You matter. And I know we hear that a lot, but truly you do. Your health matters, because, hey, if you're sick, how can you take care of your kids? I mean, at the end of the day, how could you even take care of yourself? And just become more educated on some of these topics, like we've talked about autoimmune diseases and the case of the Ambien case, and just becoming more informed and knowing the questions and being okay, like Martha said, contacting her. You can even contact me as well. If you have a list of questions that you want us to answer, definitely do that. And for men, I'm not going to be sexist today. You matter as well, because they do. And also, I feel like men need to be more educated as well about how important women are to this world and to this economy. And I think that's it.
I love that.
Yeah, we are. When I read like 90% of what we make, we reinvest into our community. I mean, we're super important to keeping this world going. And so we not only need women advocates, we need men too, to stand up and, for us as we stand up for them. Like we were talking about the 80%, and you was like, no, wait, what about the 20%? Let's making sure that we still keep this inclusive approach, but it can't be one-sided. It has to be on both sides. So
I love that. And Linda said, I got my certificate through the ERR program. That's another, Linda, that's perfect, right? Seek out certificates. There's so many free things that you can learn about research, right?
That's true.
So many things. And then he said, women are so prone to care for others before caring for ourselves.
Yes.
How it's true. And you pour from an empty cup. You fill your cup up. So I love the way you close that up. And I just want to say, and that is why we do what we do. So thank you for being here. More than a woman. Your presence matters. Your questions, your willingness to sit in this conversation. That is the community we are building. And if you know me, I am a community person. I believe community over competition. I believe the community that we choose, the community that we live in. There's our online community. There's so many different communities. And so to our sponsors, our CRO partners, and our healthcare providers, thank you that believing that community engagement is where research begins. I believe that research begins in the community. People need to understand it. People need to hear it. People need to trust it. We look forward to growing this work together. So follow us. Follow me on LinkedIn. Follow Antoinette on LinkedIn. Follow us both on all social media channels. We're on Superior Clinical Research. Antoinette is Biocentric Health Research Center. So follow us. We are always sharing gems, and follow any other research. If you have a research site, you drop it in the comments. If you're doing something great, we want to see.
And don't be afraid to ask questions.
Right?
Don't be afraid to ask questions. Definitely, like you can drop
all the questions all the time.
And questions help. Questions help the person that you're because if I don't know it, I can go find the answer. Now I know, I'm more informed.
Always have the answers to everything.
No,
we don't always have the answers to everything.
No.
We look it up, we research. Sometimes people ask me questions, I'm like, That's a good question. And one of the things I like to do is anticipate the questions that people are going to ask me. And then when somebody throw me a money, I'm like, wait a minute. And
Right.
one of the things that I love answering that, you probably going to love this too. When the participants come in and they've already read that consent,
Yes.
and that bad boy highlighted, and they like, wait a minute, what this mean? And wait
Which
a
is
minute, what that
advocating for
mean?
themselves.
Right. I love that
Yeah.
because that means they have sat in it, they have understood it. And one of the other things that I love is that when they've taken the consent, they've read it, and they've asked questions, and the informed decision is this not the right fit. I love that too because you know
Right.
why? They're advocating for themselves.
Yeah.
And so, once again, thank you all for joining us. Until next time,
Yes.
good one. Have a good one.
Thank you.